All right, good evening, class. Today I'm going to share with you all my infectious disease project. For this project, I chose neuralgia fowleri, and if you have been paying attention at all in this class, you know that this is a microbiology class and that biology is the study of living organisms like animals and plants, and that microbiology is a subspecialty of that studies that's the study of microorganisms like viruses and bacteria. So, um, my project is over an amoeba called Neuralgia fowleri. It is a cellular or unicellular microorganism that reproduces asexually and has the ability to change shape. And a little fun fact is that amoebas was discovered by August Johann Rosell von Rosenhoff in 1755. They were originally referred to as Proteus and Macul and named after the Greek god Proteus, who had the ability to change shape. So, what exactly is Neuralgia fowleri? Well, Neuralgia fowleri is a free-living amoeba found in hot springs, water, and rivers. It is thermophilic, which means that it is heat-loving, and it's extremely small in size, about 7 to 15 in diameter. Um, so the binomial nomenclature, which is just a biology term used to denote a species, is N. fowleri, and that's how I'm going to continue to refer to it beyond this point. It also goes by a couple other names like PAM, primary amoebic encephalitis, and it can also be called brain-eating amoeba, which is not to be confused with mad cow disease. So that is a little bit about what N. fowleri is. And then I'll go to the next slide. So, who is at risk? So, this can happen in any country to any person of any age because you get infected by water. So, water that is like warm and in rivers or hot springs. So, this happens because you go swimming and the amoeba goes up into your nasal canal, it attaches itself to your nasal mucosa, and then from there goes up into your central nervous system. Um, so you cannot, and I cannot stress this enough to you all, you cannot become infected by ingesting it or drinking it. The only way you can become infected is by it going up into your nostril and then it travels through your cribriform plate and attacks your central nervous system. So again, you cannot become infected from ingesting it or drinking it. So the pathogenicity and the virulence factor is that this amoeba possesses food cups in its trophozoite phase, and that allows the amoeba to literally ingest you. So essentially the amoeba is eating you, eating your brain, eating your nervous system with these food cups, which I've attached a picture to the right, as you can see. That is a food cup of an amoeba. The amoeba also releases enzymes that cause destruction to your nervous system. So that is a little bit about that, and I will go to the next slide. So the onset is anywhere from 24 hours to 8 days. This is a pretty quick infection. The medium incubation period, though, is about 6 days, and typically people succumb to this. So death happens pretty quickly at this point. So your symptoms may range, or patient's symptoms may range from fever, confusion, headache, and then some of the more important symptoms that we use to help diagnose is increased intracranial pressure and an increase in the cerebral spinal fluid, which also leads to some of these symptoms like having seizures. But that is about it for the slide. Okay, so for the differential diagnoses, this would be meningitis and astrocytoma. So you can have a virus meningitis or bacterial meningitis, but either way, that is an inflammation of the meninges that surround your cerebral spinal cord, and this comes with a lot of similar symptoms like confusion, photophobia, which is like sensitivity to light, stiff neck, fever, and that's the same for both bacterial and viral meningitis. And then there's also astrocytoma, which is a cancer of the nerve cells in the brain and spinal cord. And if you end up taking an anatomy and physiology class, you'll learn more about astrocytes, what they look like. They literally look like stars. And some of the symptoms of that are headache, nausea, vomiting, and memory loss. So the two of these look a lot like neuralgia fowleri. So the way that we diagnose neuralgia fowleri is usually by a spinal tap, and that'll be performed by a medical doctor, usually like an anesthesiologist. They will have you lay on your side and kind of curl up in a ball so that way they can get in between the vertebrae of your spine and stick the needle through, and they'll collect fluid. And so from then they'll look at the fluid, and early on it may be like a gray color, and later on in the infection it may be red. They will also test the fluid for trophozoites, which is what I showed you previously. That's one way of knowing if you have N. fowleri. They also might order an MRI, and usually the MRI will show abnormalities of the subarachnoid space in the midbrain. So for medications and treatments, there's a couple different ways that they might treat this. So they will use amphotericin B and fluconazole, and so the amphotericin has amoebicidal properties, and so usually it's typically like a 10-day IV treatment, and they combine this with fluconazole, which is actually an antifungal medication. And if you end up taking like a nursing course or a pharmacology course, you'll learn that anything that ends in azole is antifungal. So I found that really interesting that they combine an antifungal to treat an amoeba medication. But the role of the fluconazole is that it actually helps penetrate the central nervous system deeper. So it allows the amphotericin B to further penetrate. They also might use rifampin, which has been used in every known case of N. fowleri and stops about 80% of the growth. So for clinical research possibilities, there's not really a whole lot that they can do for N. fowleri. We just kind of gotta, I guess, prevent it in a way. So we can't do clinical studies because it wouldn't be ethical to purposely and intentionally infect people with N. fowleri. So as of right now, we've just got to collect scientific data as we see patients infected. Let me see. Oh, and the immune response, I also wanted to touch on this. The immune response with this is so fast. I mean, people literally are dying within like a week of getting this, that we don't really know how N. fowleri affects the immune system to really come up with a good medication regimen for this. So for prognosis and prevention, I mean, there's a high chance of dying. You literally have like a 3% survival chance, and there have been out of a 3% chance of survival out of the 151 known infections as of 2017. There was only 4 known survivors. So the way to prevent this is by not swimming in freshwater lakes, rivers, and hot springs. But you can swim in clean and chlorinated pools. So if you go to the gym or you go to like a water park, that's perfectly okay. You're not going to get N. fowleri from that. But I did, again, want to stress this for the test, hint, hint, that you cannot get N. fowleri from ingested. You only get this by swimming, and it goes up through your nose into your mucosa of your nasal cavity and then infects your central nervous system. So some of the sources I used were the Center for Disease Control. I found an academic journal. and I use the American Society of Microbiology. So those were just some of the sources I used. You cannot, I don't recommend using like Facebook as a credible source or your grandma. But other than that, that's it. That's the end. I hope you guys enjoyed my presentation.